and all their agencies, as we have over the entire course of COVID-19, to prevent any mistakes from happening again. Currently, we have no further cases recorded on board this ship. A WA medical assessment team will go on board again today to complete further assessments of the remaining crew. Contact tracing systems are in full swing when it comes to close contacts. Fiona Stanley Hospital has been identified as the receiving hospital should any ship-based crew become unwell and need urgent medical attention. The situation is currently under control, but as I said yesterday, it continues to evolve. That's why we are ready and prepared to handle the situation if it escalates further. WA State Health Incident Coordination Centre, the SHIC, is finalising a management plan for the ship in conjunction with federal authorities, and more information will be released when that is possible. Plans are underway to remove 27 crew as a precaution, transferring them to a Perth hotel. The remaining 15 crew on board will remain on the ship as a skeleton crew, and they will be monitored on a daily basis. I want to reiterate, we've come a long way since the cruise ship saga, and that experience means we are more prepared than ever before to deal with these kinds of problems. We'll continue to do everything we can to protect West Australians and prevent the spread of COVID-19 in our state. I'll now hand over to Roger Cook.
Thank you, Premier. Can I just begin by thanking all healthcare workers for the great work they're doing on a daily basis. In particular, can I just thank all those workers in our hospitals that are standing ready to assist these merchant seamen as the need arises. I'll move into the general COVID update. We have no new cases of COVID-19 to report today. So our state total remains at 570. We continue to have 12 active cases in Western Australia, 6 are crew from the Kuwait, 4 are from Victoria and 2 are Western Australians. I'd like to take this moment to acknowledge the work of the International Transport Workers Federation in looking after the crew members on board and recognise their important role as a stakeholder in this ongoing event. None of our active cases are in hospital. 549 people have now recovered from COVID-19 in WA. 784 were swabbed at the COVID clinics yesterday. There are now more than 80,166 to be exact, tests performed on Western Australians. I do have some good news to share about the McGowan government's Detect program. Today we are launching Detect Snapshot. Detect Snapshot is the next phase in the Detect program, which is a nation leading in the testing of asymptomatic people. Detect Snapshot, which goes live for 2 weeks tomorrow, will see a testing blitz across cohorts that are of interest with COVID-19. This project aims to get a better understanding of potential COVID-19 that may be in the community and not yet detected. More importantly, it will provide the government and the public with greater confidence that we are on top of this virus. People from specific cohorts who are not showing symptoms of COVID-19 can go get a test for the virus at one of the COVID clinics, including a drive-through facility at Burswood, or from a range of privately operated pathology providers. We will be utilising some of the testing resources provided by the Minderoo Foundation, so I once again thank Andrew Forrest and the Minderoo Foundation for the important role that they have played in the fight against COVID-19. Their help has significantly bolstered our testing armoury. Eligible groups that are part of the testing blitz include healthcare workers, including WA Health staff, private hospitals employees, employees of residential aged care facilities, general practice, pharmacies, disability sector employees, or any worker employed by an organisation delivering health services. WA police staff, meat workers employed in an abattoir, meat packing or in further processing such as small goods manufacture, retail workers such as employees in supermarkets, department stores and specialty stores, and hospitality workers such as employees in cafes, restaurants, pubs or hotels. These groups have been selected mainly for their frequent interaction with the public during COVID-19 or where documented outbreaks have occurred in other jurisdictions.